Together, our volunteers and our supporters are changing things for the better here in Houston. We're really glad that you all took the time to come together today for our annual awards luncheon. And what I'd like to do first is I'd like to make an announcement. This year we're really excited because we have recently hired a new director of operations. And Leah Halley, where are you sitting right now? Way back in the back. She's been working, of course. And if we could just recognize Leah and welcome her. And we're very pleased once again to have for our Masters of Ceremony, Carrie Feibel, who is from KUHF, the National Public Radio station, and she's the health and science reporter, and she's been with us every year, and we're really excited to have her back with us again, so I'm going to turn it over to Carrie for a few.
Right now, I'm just going to thank our wonderful sponsors, some of the institutions that have made this luncheon possible, and those include HealthBridge, Children's Hospital, Texas Children's Hospital, Houston Methodist Hospital, Legacy, Community Health Services, and also Memorial Hermann and Children at Risk, and also all the individuals who themselves stepped up to sponsor tables today. Thank you so much.
Thank you, sponsors. And I'd like to actually recognize some of our hard workers in our organization. Could I first have all the members of the board please stand and be recognized? And stay standing for now. Now could I have all the officers of the organization please stand and stay standing. And the chairs of the committees, all the chair people of the committees, if I know some of our chairs are not here today because they had another event going on at Baylor, I think. Anybody who's actively working on a committee, could you also just stand, please? All right, thank you, everyone. And you know, when I was preparing my thoughts, I thought back to the very first DFC meeting that I ever attended, and I can really remember that meeting well. And I remember my first impression was, this group really gets things done. And one of the things that we have accomplished this year that we're the most excited about is we brought a long-term project to fruition, and that's the Doctors for Change Access to Care Guide and Access to Community Resources. We believe this guide has the potential to truly be transformational. We're working to partner with institutions to implement the use of the guide in an integrated fashion. We certainly know that the guide makes a difference when individual healthcare providers use it to help their patients. And I have a brief story to share with you. Literally the day after our food insecurity forum, I saw a retired 65-year-old patient named Nicholas T. And he came in for a glaucoma follow-up exam, and he was not doing well with his glaucoma or with his diabetic eye disease. And I recognized from a couple of questions we asked him that he may have some problems with access to food. And so I used the two questions that we learned about the night before, and those are available in the guide, to screen him. And sure enough, what I found out is he had no access to healthy food, and he was actually living on crackers. So we could preach to him all day about good control of his blood sugar, and that wouldn't help him improve his eye health. So we were able to give him information about Meals on Wheels and about food banks near his home. And when he returned about 3 months later, he was a profoundly different person. He went from being depressed to being very vibrant, and his health reflected the changes that had been made for him. And we'll talk about the guide later in the program. Right now, I'm going to turn this over to Carrie. Thank you, Carrie.
Thank you. Hello, Doctors for Change. It's really good to be back here once again as your MC. And I can't believe it's been a year already, and it's been quite a year. We had the legislative session, which had its successes and its failures, and I'll leave that to others to discuss. But that did get me thinking about some of the successes and failures in my own work, and I wanted to share two very quick stories that I think we can all relate to, whether we are reporters or doctors or attorneys or advocates. And we are all, I believe, intent on doing the best we can to sort of share the stories of healthcare in Texas so that people know what's really going on and can take action. So one thing that happened to me was what I would consider both a success and a failure. And it was a success in that I got a story on national NPR that highlighted Houston and a very innovative program that we have here involving our 911 system. And in a nutshell, basically Houston EMTs and paramedics now have a computer tablet in the ambulance with them. And if they go on a call where the patient does not need to go to the emergency room and they just need some primary care, they can call up on the tablet an emergency room physician and start a sort of video chat, Skype style call, and the doctor can, on the tablet, see the patient, talk to them, and then make a judgment call. They actually really don't need to go to the emergency room. And in addition, they can also set up an appointment for them right then and there at a primary care clinic near their house. And they can also book a taxi cab ride there and back for free. So it's a really tremendous program. It's very new, but it seems to be going well. And I got a lot of positive feedback. People are very interested. Programs like these can reduce ER overcrowding. They can cut healthcare costs. They can even perhaps find some patients a permanent medical home in their neighborhood that they didn't know about before. But it was kind of funny to me because I was talking to one of the paramedics about why people call 911 when they don't really have an emergency. And there are a lot of reasons behind this that, I won't go into now, but they, include things like people just don't have a car. But one reason he kept talking about is that people just don't know about the clinics that are there, that might even be in their neighborhood, that might be free to them, that might even be a walk-in clinic where you don't even need an appointment. And he said some of these clinics are near to them, but they don't know about this. And I said, well, why don't you have some sort of flyer in your ambulance that you can just hand out when you get to a household, and maybe that person does need to go to the ER, but then the household would have this flyer the next time they were thinking about calling 911. And he just sort of said, that's interesting. And I sort of said, that's interesting. And maybe I'm naive about these things, or there was some reason why this totally wouldn't work that I just don't understand. But it taught me that, once again, there are still silos in our healthcare community in Houston. And even though this laptop program was really doing something innovative, there might be other ways that we can get the information out there and these different communities can talk to each other. And I know that Doctors for Change has been working on that. So you'll hear a little bit more about that later. And the other funny thing that happened to me this year was pretty soon after the luncheon last summer. It was August. I was at the University of Missouri in Columbia, and I was there for some training for health reporters from very prestigious experts and other healthcare journalists who had done a lot of work. And there was one woman who I will leave unnamed, but she was a very well-known journalist in healthcare. She was there to speak to us about nursing homes and nursing home quality measurements, and she was as intelligent and as credentialed as you could expect in my field. She lived in New York City. She had written for the Consumer Reports and The Nation. She had won every healthcare reporting award that you possibly can. And she was on the boards of journalism groups. And afterwards we were chatting, and she understood that I was, reporting in Texas, and that was kind of my beat. And she said, "Oh, your governor, Rick Perry, he was just indicted." And I said, "Yes, that's true." And in fact, it happened a week previous, last August. And so she knew about this, and it was, fresh news. And then she said sort of gleefully, she said, "Great, that means now you can have Medicaid expansion in Texas." And I sort of looked at her and thinking to myself, wow, would that it were that simple, that it just takes one thing like that to make it all come together. And we talked a little more, and I realized that she didn't know that Perry wasn't running for governor again, and that the indictment had nothing to do with his decision not to run again. And in fact, as we all know, he's running for president now. And she also didn't know who Greg Abbott was, had never heard of him, and she didn't realize that, he was equally against expanding Medicaid. And so I sort of walked away from this conversation realizing that, even very intelligent, informed people outside of Texas often don't really understand the complexity of what we face here in Texas when it comes to healthcare. And even if they are sort of watching and listening, they might just have a pretty simplistic understanding of it. So that kind of lit a fire in me that I need to keep doing these stories. And even if I feel that I have mentioned Medicaid expansion and why it is or is not happening in Texas a million times in my story, and I'm probably boring all of you commuters who listen to NPR in your cars, oh, I've heard about that again. I realize that, there might be listeners out there who haven't heard those stories and may just be hearing about Medicaid and those issues for the very first time. So I'll continue to do those stories, and I know you will continue to do your part to raise awareness, and maybe next year we can get together and share notes. So with that, I would like to turn this over to the co-presidents of Doctors for Change, and that is Claire Bocchini and Charu Sahani, and they will take it from there. Thank you.
All right, well, I'd like to thank you all so much for being here. This is really an incredible turnout, and this is very exciting to see. I'm Claire Bocchini, one of the co-presidents of Doctors for Change.
And I'm Charu Sahani, the other co-president.
And I please invite you to eat and enjoy your salads and your lunches. I know we're have a full program today, but we definitely want you to be able to enjoy your lunch as well. So we get the opportunity to talk to you a little bit about what Doctors for Change is. I know some of you, this is probably your first time hearing about us, and we really thank you for coming and learning about us and supporting us. So we get to give a very brief update of what Doctors for Change is. Well, we have our mission is that Doctors for Change, our mission is to increase access to care and improve the health of all Houstonians and all Texans through 4 ways. One is through research, one is through education, one is through collaboration with other community nonprofits, and the last is through advocacy. And this is a picture of Jamie Freeney, our Access to Care Committee chair, who's back there, and she's doing an event at the Houston Public Library, and this really embodies our mission of trying to get out there working with patients, advocating on behalf of patients to improve health. Our vision of DFC is to make Houston and Texas healthier by ensuring that all persons have access to high-quality health care and that all communities have the resources they need to promote wellness and promote mental and physical well-being. We believe that healthcare should be universal, affordable, accessible, accountable, and just. So who are we? We are a group of healthcare providers that got together back in 2006. Actually, next year will be our 10-year anniversary as an organization. And there was a group of about 5 or 6 of us sitting around a table talking about these basically things that we didn't think were just or right that our patients had to face to try to get access to care. And so we decided we wanted to form an organization to do something about it. Well, we've grown quite a bit. We became a nonprofit, an official nonprofit in 2007. And over the past 9 years, we've grown to now over 1,000 healthcare providers and other non-healthcare providers who are very committed to helping us with our cause. And we're not all doctors. We're nurses, we're physicians, we're healthcare trainees, we're social workers, we're public health experts. We're also lawyers and people with business knowledge and with policy knowledge. And we're also people in the community who just are really passionate about improving the health of our community. And we've come together now. This is actually a group of Rice students who did an alternative spring break with us to be able to do more about health policy and actually go to Austin and get out into the community to make a difference. So we work all together to improve these inefficiencies and injustices in healthcare. So we pick these terrible, unacceptable realities, as we call them, such as the fact that we have the highest number of uninsured residents out of all states in the country, such as the fact that over 50% of children at some schools here in Harris County are overweight or obese, and that mental health services can be very limited, and our patients can wait months for access to mental health services when they really need them now. And what we do is we take these big unacceptable realities and we take a little piece that we think that we can actually address and we can make a difference. And we do that through our 4 areas: education, collaboration, projects, community involvement, and legislative advocacy. We have 4 committees that work tirelessly throughout the year to accomplish these missions, and one committee is on improving access to care, another is on mental and behavioral health. We also have a healthy eating, active living. We're trying to improve wellness in the community committee. And then we have a committee on trying to address anti-human trafficking. We have a group of healthcare providers who are teaching other healthcare providers about recognizing victims of human trafficking in the clinical setting and how to get them help. We have student chapters both at Baylor College of Medicine and at UT Houston that have just done a tremendous job over the past year educating other students and other healthcare providers in the medical center about our issues and doing amazing projects in the community. And we have had several educational forums for the general healthcare community where over 1,500 healthcare providers have taken part in them. Every year during this luncheon, I get to highlight a committee. And this year, it's the Healthy Eating and Active Living Committee. All of the committees have done wonderful things, and I really hope that you've been able to look at the posters as you came in, because that really highlights some of the great work all of our committees are doing. But I'm just going to give you an example of what we do, and that's with the Healthy Eating and Active Living Committee today. So the unacceptable realities that we're addressing is that 20% of households here in Harris County and in Texas are food insecure. 1 in 4 children is living in a food insecure household. That means they don't have enough healthy food to eat to help them grow and to learn and to, grow up to have a wonderful, healthy, productive life. Another unacceptable reality is up to 50% again of Harris County children are overweight or over obese, especially in certain schools. So what is our winnable goal or unique approach? Well, one, we can screen our patients for food insecurity. Nancy, you actually told a perfect story of a time where how can we counsel our patients about trying to improve their diabetes, or in kids try to improve, their being overweight, which they grow up to have a lifetime of comorbidities, if they can't even have access to healthy food. So we can screen our patients and actually address food insecurity right in the clinical setting. And then another winnable goal or unique approach is that a lot of schools want to improve wellness, and we can serve as a resource for them and actually partner with schools to help them achieve their wellness goals. And those are some of our specific ways that we go about trying to approach these issues in Doctors for Change. So just to take you through what the Healthy Eating and Active Living Committee has done over the past year, they held a big forum in 2015, where you can see we collaborate with lots of other organizations. We don't pretend to be experts on fixing all of these problems ourselves, but we collaborate with other organizations like the Food Bank, Hunger Free Texas, Recipe for Success, and the American Heart Association. And they came and they taught us how best we can screen patients for food insecurity and get them services and get them enrolled in things like SNAP and WIC, and have access to food pantries, and then also have access to healthy food more permanently. And then we also took on this initiative to train people to be able to screen their patients, and we have a number of endeavors in multiple different hospitals trying to screen patients and regularly get them access to healthy food. We also have a lot of community outreach, and the Hill Committee partnered with the Access to Care Committee to do our doc days. Again, we go out to the Houston Public Libraries, we talk to patients, we screen them, we talk to them about food insecurity, about wellness, and also about getting access to care. We also partner with local schools, and this is Anna Monterey, one of the leaders of the Hill Committee, who's actually working with an HISD school right now. She comes in and talks about best practices, what other schools can do to try to improve wellness. And she works with the schools. The schools make their own goals. We just serve as resources. So if one school wants us to change some family recipes into healthy recipes, and the school makes a cookbook, we do that. Another school wanted to make an after-school running club. We help them do that safely. So they basically have us serve as consultants to try to improve the school's wellness and achieve their wellness goals. They've also put together this online school health and wellness toolkit, which includes a lot of different programs you can instill in your school. You can also have grants that schools can apply for and get funding for these projects. We have a big art competition where students can participate, and the theme is celebrating a healthy mind and body. So we try to get kids to teach other kids why it's important to be well, and they do this through this competition. Here are some of our winning entries, and you can also see some of the winning entries along the back wall there. And then, of course, advocacy. We have a number of legislative advocacy initiatives, and our Hill Committee was very active around 4 policy areas this year and had especially good success in trying to make it easier for people to have a community garden as a great way that you can have access to fresh produce. And also, we had some success this year in breastfeeding promotion and breastfeeding ease in the workplace. And this is Deanna, a student who did her research project at Baylor on trying to, about women who want to breastfeed at work and their experiences, and she was able to turn that into a policy brief. This is Nikki, one of our other committee chairs, who's doing a social media campaign on why it's important that every child improves the opportunity to live well with access to food. And I know, Carrie, you mentioned briefly about the Texas legislative session. We went to Austin several times this year, met with over 90 offices, and were very active participants in trying to pass several bills. You probably saw on the committee posters a lot of our success this year, just to highlight a couple, because it's really, every year we have some wins and we have some loses, but our goal is every year we're going to keep going, and in the next year we're going to get more done. But this year actually went surprisingly well. I'll highlight just a couple things. This is an op-ed written by Dr. Gerald. Is she here? No, but she's probably on her way. So she just had written an op-ed about the Palliative Care Council, Advisory Council, which is a bill that's going to help try to improve access to palliative care here in Texas. And so we're very excited that this bill has passed and is on the governor's desk to be signed. We also have a variety of other bills that we worked very hard that are actually going to improve the access to mental health care in the community, such as an evidence-based loan repayment program that's actually going to bring more healthcare providers, and not just physicians, but social worker, counselors, psychologists. We're going to get a lot more mental health providers here in Texas, which is desperately needed. We also worked with Children at Risk, who's here, and thank you for your guidance on these bills. We worked very hard to try to get evidence-based pre-K that actually helps children, has been linked to better health outcomes, and we also have really pushed for evidence-based parenting support programs so we can try to prevent child abuse and, again, reduce toxic stress and help kids grow up to have a healthy lifestyle. So we had several nice wins this year. This is Wilson Lamb and Sarah Curtis. Sarah is one of our HEAL committee chairs. Wilson is one of our past board members, and I think Wilson went to every one of our Austin advocacy days. This is Judy Levison, one of our board members, and this is Representative Jean Wu, and in this case we're actually talking about a human trafficking bill that also did quite well. So with that, I just can't thank you guys enough for your support. I mean, all these people in this room are helping Texas become so much more, so much healthier. And we've actually had great policy. We have great programs in schools, in the community. You guys are really doing tremendous work, and I can't thank you all enough. And this is a really wonderful time to be able to celebrate your accomplishments. It really is amazing to me to see how much we've accomplished in the past year. So with that, I think that is our very brief and fast update. And now we get to do our awards, which is always a very special part of the luncheon.
It's my great honor to present the Appreciation Award to Ellen Schwaller. Ellen was our first executive director, and it is her hard work and dedication that has gotten us to the point that we are today. I wanted to briefly highlight some of the things that she was able to accomplish for DFC. She launched our new DFC website. She organized forums, board meetings, our annual leadership retreat. She was able to significantly increase the attendance at our forums and also taught us how to reach a wider audience. She represented DFC at Houston community groups and with stakeholders, and she organized and streamlined our policies and procedures. Over the 2 years, we got to know her very well. She became our colleague, she became part of our family, and we wish her the best of luck in her future endeavors and want her to know that she always has a place here at DFC. Please welcome Ellen Schwaller.
Yeah, we really can't thank Ellen enough. Ellen has been responsible for truly transforming our organization. So our next awardees, and if you guys could come on up, our trainee awardees, I'm very excited to announce. Every year we have healthcare advocacy awards, and we take someone who has really made a tremendous impact in the community in their professional life, and we pick trainees who've made a tremendous impact on the community while they're still in healthcare training. And this year we have two amazing awardees. Our first awardee is actually Dr. Tina Menshadi, who is a third-year pediatric resident who has been very passionate about caring for the underserved. It actually has finished the care for the underserved pathway both in medical school and in residency. And, I'm going to be brief because I know I tend to be too long-winded, but Tina, we had this concept, Nancy mentioned it, this care for the access to care guide, teach healthcare providers how to help our patients get access to health insurance and to community resources. And it used to be this little 20-page pocketbook that you kept in your white coat, and it had a little bit of information in it, but not quite enough that you could actually hand your patient a paper and exactly where to go to help them with their problems. And then Tina came along and had the commitment and the creativity to go all over Houston, month after, she spent an entire month doing this, and then after that just kept helping a whole team of people go around and collect these resources so that we could then help our patients with their social needs. And so Tina and then Camille came on to this project. Camille comes with us with tremendous background in actually trying to make these resource access to care guides. She's a third-year student at UT Houston, MD MPH student. And she also has made a similar resource. She's an Albert Schweitzer Fellow, and she made a resource that's very similar for the Help the Homeless clinic to be able to help homeless patients get resources. And so these two have made this tremendous guide that now has thousands of resources, and it's streamlined in a way that it makes sense so that you can help your patients with these social needs. And they've had over 300 users per on their website every week. They've created this guide. And for this, this has had tremendous, it's going to be a wonderful resource for the community. And for that, they have won this award. And I'm just really happy to be able to give them this award. So come on up. Here's yours. So we'll do a quick picture. Okay, come on. Okay. And now they're going to actually take you through the guide and teach you a little bit about how to use it. I hope you all got those little cards when you came in. And actually, now's a great time to pull out your smartphone so that you can play along.
Thank you so much, Claire, for the wonderful introduction.
Okay, thank you. So our goal for this guide was to create a resource for healthcare professionals to address the social determinants of health that critically impact the health outcomes of our patients. And we were motivated by the fact that our patients and their families are facing tough realities. 30% of children lived in poverty in Harris County from 2007 to 2011. In this county, 1 in 5 households are food insecure. And the U.S. Census quoted in 2013 a total of 25% of Harris County residents and 14% of children that lacked insurance. Another motivation for this guide was from a needs assessment survey performed by DFC of 72 Baylor medical students in 2010 that showed that less than 40% of them regularly asked patients about topics like insurance status, food insecurity, access to mental health care. 26% felt comfortable asking patients about these issues, and only 11% felt that they were aware of resources other than calling their social worker that they could provide patients about these topics. And it's important to consider this aspect of how comfortable health professionals are in identifying these sensitive issues and then appropriately providing resources.
So we hope you've gathered from what Claire mentioned earlier how important socioeconomic barriers are to health in general, and this is just another evidence of that. They have the greatest impact on health outcome. As a pediatric example, having a low income actually increased mortality rate, led to more chronic diseases, poor nutrition and growth, more obesity, lower immunization rates. And that left only 59% of these poor children having a good health outcome compared to over 90% of those children who are living above 400% of the federal poverty level. So the overall objective, as Tina alluded to, was to create a resource for providers in Houston and Harris County to be able to efficiently identify the needs of their patients, as well as provide resources to address all of those needs. So we will excuse you this one time, pulling out your phone at the table, to please check out our guide, which is located at www.dfcguide.org. It can be accessed from any device that has internet access. And just as an example, if you have an iPhone or it's similar on Android phones, there's an option to select Add to Home Screen, and this makes it appear on the desktop as your phone, similar to your other app icons, so you can easily access it whenever you need to look up resources. So we wanted to take you through a case example. This is our method of getting you used to the guide and giving you a little taste of what all is included in the guide. So this time I'll turn it over to Tina, and we'll actually pull up the website and walk you through it.
Okay. So we'll start with this case of a 7-year-old boy and his grandmother who are coming to a family practice clinic for their first appointment. You find out that the 7-year-old boy is overweight, and the grandmother is concerned about maintaining their health status on limited income and without any health insurance. So we pull up the website, and once we enter, let's address this lack of health insurance first. So we'll go to the insurance options. And here at the top, you can start with just getting a nice overview on different health insurance options. So you can read from the Texas Department of Insurance all the way down to the ACA. And then there is a nice health insurance flow chart created by one of the DFC members, Miss Arena, that nicely sort of helps you to navigate through and decide maybe what's the best insurance for your patient and their family. So if you go back, there's different options like you could, maybe if they're eligible for the health insurance marketplace, or the child might be eligible for CHIP, the grandmother maybe for Medicare. And if they're not eligible for any of these, you can go to the bottom and it'll take you to the next section, which is care for the uninsured, and there's options. So the next big issue for this child and grandmother was the food insecurity. So if we go to community resources, and then we find the food insecurity topic, here the best, the resource right at the top is Texas 211, which is, if anything, a great resource you can give your patients and their families, and they can find the best resource close in their zip code area. They can, there's a Houston Food Bank and other food banks available. And then maybe for this patient in particular, we could give the summer feeding program for them during the summertime so this child doesn't go hungry. And then the next big issue was that our 7-year-old boy was overweight. So back in the community resources section, if we find the obesity and wellness topic, we can give medical resources if they're interested in working closely with physicians on how to lose weight. There's exercise programs like from the Houston Parks Department, as well as the YMCA. There's nutrition classes available from Houston Food Bank or Can Do Houston. And the best part is at the bottom, which is the patient education section, where you have patient handouts. And there's a list of brief, high-yield handouts that you can easily print and give your patients. So an example is like 25 healthy snacks for kids or eating healthy for older adults. So you're tackling everyone in the family. And there's many more resources in the guide, so we just picked just a few to highlight in this case. So future directions, over the next year, we hope to continue to educate healthcare professionals in the Houston community through educational sessions on how to navigate through the guide with case examples, just like the one we've shown. And then we hope to study the clinical usefulness of the guide and how it enhances and facilitates providers' ability to provide these resources with pre- and post-educational surveys.
A few other future directions that we're excited about are getting the guide translated into Spanish. This is a big task, and so we appreciate any donated efforts towards achieving it, but we think it's really important, especially for the community that we live in. We're also working on methods of maintaining continuous feedback and updates via the feedback. So we do currently have a feedback link on the site. If you see anything that's incorrect or you don't see a resource that you use often and you think it should be included, we appreciate all feedback, and everything gets reviewed and inserted in the proper location within the guide. We also are working on a few different options for grants and other sustainable funding, and that's going to be a key issue in keeping this guide alive, and we hope that you agree that it's an important cause and that it'll be beneficial to you, whatever your role is in the healthcare field. These are just a few of the many people who have contributed a lot to the guide so far, and we just wanted to acknowledge them briefly. Claire, of course, is kind of our mentor, guide, or leader, fearless leader, and we appreciate all of her help with the guide. Ellen, we appreciate all your help as well. You really got the ball rolling and got the guide started while you were at DFC. Jamie Freeney, she contributed a lot to numerous sections of the guide and provided a lot of the invaluable resources that you see located within the guide. My brother, actually, Cody Keenan, did a lot of the back-end work. He lives in Seattle, so couldn't be here, but he's been working remotely in order to keep the guide, up to date and, doing any updates that we see fit, when we decide to add new functionality and things like that. So we're excited to have him involved as well. And of course, Doctors for Change, couldn't have done it without them. Texas Children's Hospital, Baylor College of Medicine, the Harris Health System. Of course, we include many of their clinics and other resources there as well.
Thank you.
Yeah.
Right now, it's my distinct pleasure to introduce our speaker for the day, Judge Ed Emmett, who's the Doctors for Change 2015 Healthcare Advocacy Award recipient. Judge Emmett is well known in our community, and especially to anyone who was here during Hurricane Ike, right? He became the county judge in 2007, and I'll just refer you to the bio because I want to give him as much time as possible to speak, so just take a look at his very impressive bio in our program. Harris County is the third largest county in the U.S. There are over 4 million residents of this county, and we have a county population that's greater than 24 states do. This county is governed by a commissioner's court that's comprised of 4 elected commissioners for all of the county. The county judge is both the voting member and he's the presiding officer of the Commissioner's Court. He's also the county's director of emergency management. Judge Emmett has a huge job, and I've noticed he's very humble about his role, but he's been a force for much positive change in our community. And we are honoring Judge Emmett today for his leadership and vision for improving the health of our community in many ways. I'm just going to tell you some of the reasons why we chose him to be our honoree today. He's a strong proponent of community-based preventative health care. He's an advocate for the working poor and indigent persons to have access to adequate health resources. He stood up for the expansion of Medicaid. He testified in Austin that it was the right thing to do. He's passionate about mental health. Judge Emmett worked with allies in the 2013 legislature to establish and fund a jail diversion program here in Harris County to support as a resource for people who are in jail, mainly because they're mentally ill. And I know he's going to tell us a lot about this program, I'm sure, about where we are now and how it will most likely become a model for other areas in the state and perhaps the country as well. He's indeed a strong advocate for more state funding for mental health resources, and he's an advocate for the future. He's especially an advocate for children, and he's established something that's called a Whole Child Initiative. When we talk about the social determinants of health, we often see people's eyes glaze over, but Judge Emmett has a gift of communication. He makes complex concepts that affect the health and well-being of our residents understandable and meaningful. He's able to gain a broad base of support for his initiatives. I'm going to read you one of his quotes that sums up why we have so much respect for Judge Emmett. It's right here. Healthcare defines us as a society. Leaving people without healthcare is not good for them, our community, our society. Judge Emmett, would you please come forward and accept our 2015 Doctors for Change Care Advocacy Award? Do you want a quick picture of it?
Well, good afternoon. First, thank you very much for the award, but more importantly, thank you for what you do, because that's very, very important. Before I start, the size of the county was mentioned and my role was mentioned, but it's a little bit difficult. I have to explain to people all the time what a county judge is. I'm not a judge. I'm not a lawyer. And I preside over Commissioner's Court, but it's not a court. It's a Texas kind of thing. Carrie, whoever you were talking to in Missouri, they'd probably never understand that. What I thought I would do today, rather than just give you a speech about what I think about various things, I thought I'd let you know how a person like me even got involved in these subjects and how I came to the positions that I came to. Because if we're going to really make change for the better when it comes to healthcare, you're going to have to convince people who aren't in this room. You're going to have to convince people who don't think like you. You're going to have to convince people who are not experts in the field. And I tell people all the time, when I went to the legislature in 1979, yes, I'm that old, it was a long time ago, the first vote I ever cast was on a brucellosis bill. Now, for those of you who don't know, brucellosis is a disease of cattle. I knew nothing about it, absolute zero. And I turned around to Foster Whaley, who owned a cattle feedlot in Pampa, Texas, and sat behind me. And I laughed. I said, Foster, does it bother you that my vote counts as much as yours on this? And he said, that's okay. I get to vote on mass transit later. And that's what you have to understand. Whether we like it or not, public policy is going to be set by people who are not experts, and the forces that come to bear on them, we don't always even know what they are. So I thought I'd just give you some indication of how I came to the positions I came to. First, I come in as county judge in March of '07 as a transportation guy. That was what I was supposed to do. I was supposed to help us improve transportation, make freight, commuters, all those things move better. Hopefully get the commissioners to get along with each other and all work together. I think we're getting there. But the very first thing I had to do was run for election in the March '08 primary. And political consultants love to take polls. And they love to then tell their candidates what they should be thinking. And my political consultant took a poll of previous Republican primary voters, and the number one issue was illegal immigration. And so the first thing the political consultant said was, you know what, here's what really burns people. The fact that illegal immigrants are being treated in the Harris County Hospital District. It wasn't Harris Health back then, but Harris County Hospital District. You need to come out and say you're going to do everything you can to keep that from happening. Well, I don't normally just jump when people say jump, except for Gwen. Y'all, those of you who know Gwen, be sure and tell her I said that. So I started talking to people, and Dr. Palacio was our public health director at that time. And I was reminded that, oh, by the way, Judge, you are also the Director of Homeland Security and Emergency Management. That means you're supposed to keep the community safe. And that means, well, let's think about these people. Number one, there's a federal statute that says anybody who shows up at an emergency room has to be treated. Number two, doctors take an oath to help people. And number three, if you want to be sure that there's not some outbreak of some dread disease in the community, then you need to make sure people have access to treatment. And the emergency room's not the best place to do that. So instead of saying, no, we're not going to treat them, I, even in a Republican primary, jumped to the conclusion and said, you know what? not only are we going to treat everybody, we're going to find a better. This thing's attacking me. We're going to find a better way to treat people. And that started the whole idea of establishing medical homes and working with the neighborhood clinics and looking at the FQHCs and making the whole system work better. That was not a very predictable position for me to take, but it was the right position. And it reminded me, this is off healthcare, but it gives you a little bit more in the mindset. In the early 1980s, when Craig Washington was the state senator and I was a state rep and Bill Clements was the governor, we actually passed a prison reform bill that allowed families to have contact visits with their loved ones who were in prison. And that was sold on the basis of, and remember Governor Clements is the one who put prisoners in tents. Nobody could accuse him of being soft on crime. But we went to him and we said, look, we always campaign on family values. We want strong families. And the prison system is doing everything it can to destroy those families. He said, you're right. So even a Bill Clements, if presented with the right facts, would do the right thing when it came to prison reform. So it's that mindset that I kind of carried over into healthcare. Well, I hadn't been here very long as county judge when it started being pointed out to me that the Harris County Jail is the largest mental health facility in the state of Texas. And that's just fundamentally wrong. I mean, it's just wrong. And so I started going back and looking at, okay, what happened? Well, what happened is 25, 30 years ago, the state decided to deinstitutionalize the mentally ill for a large portion, but they didn't do anything else. And if you were a well-to-do family or you had other resources that you could take care of your loved one who had some mental condition, you were fine. But a lot of those people ended up on the street, and they ended up becoming what we know as frequent flyers through the Harris County Jail. So I and many other people, Dr. Santos being one who advised a lot on this, looked at the idea of, isn't there a better way to deal with people with mental issues? And the answer is, of course, you put them in the mental health system, not in the criminal justice system. And how does that get sold? Very easily. It costs a lot more to deal with somebody in a criminal justice setting than it does in a mental health setting. It is far better outcome for the individual and their family and society if they're dealt with in a mental health setting. So that's how the jail diversion program got started. And the good news about mental health, and by the way, I have to obviously make a side visit because I tell everybody this. Why did I care about mental health? Because my father had a mental condition. He had a panic disorder. And I won't take the full time to tell everybody today that whole story. But basically, if he had not been a mid-level oil company employee who had good friends to make sure he got from one place to another, he probably would have been one of those people who kept showing up in the Harris County Jail for being a vagrant, because he always had to be around somebody. And so I venture to say there's not a table in this room that doesn't have somebody, a relative, a close friend, a neighbor, that has a mental condition of some type. And so my personal background, and then just the logic of getting people into the right system, said, okay, mental health's going to become a priority. There is very good news on that. In Austin, they may not be giving us as much money as we want yet, but at least there's no argument about it anymore. From the far left to the far right, pretty much everybody agrees mental health is something we need to invest in. So groups like yours and all the other groups that have worked on it are to be commended, but we need to keep moving the right direction. The third issue that came up really stunned me, and that was immunizations. I grew up in the polio era. I remember East Texas oil field workers literally crying in the gymnasium of New London High School, not out of sadness, but out of joy, because suddenly their children could be immunized against this dread disease, polio. Some of us, I started saying most of us, but looking around the room, not all of you are quite that old, measles, mumps, all those childhood diseases, I had all of them. Kids today don't have them. But suddenly in Austin and other places, immunizations have become bad. And the classic was session before last when, I won't say his name, but I called a state rep who had voted against the bill to require healthcare workers to be immunized. Who could be against that? I mean, it's mind-boggling. And I said, why did you vote that way? And it failed the first time. He said, because I just didn't want the crazies coming after me in the primary. And it's the truth. So what do we have to do? Well, how do we get in this position? In a most bizarre thing, when the doctor in the UK did his study that has since been totally debunked, that said childhood immunizations cause autism, he no longer can practice medicine. His study is just completely written off. But where did he move when he left the UK? To Austin, Texas. Sometimes this keep Austin weird, it gets carried away. And in the most, really strange confluence of groups, we had Hollywood, I hate to use left-right, but I will, left-leaning Hollywood types combining with the Texas Eagle Forum and groups like that, and we had this perfect storm. And they get out and they vote and they get on the web and the Facebook and they talk about all these plots to take their children. You're the experts. We're going to have to weigh in. We're going to have state reps on immunization say, well, I got these crazies and then I got this group of crazy doctors over here. And we're going to have to really get engaged, because the public overwhelmingly supports immunization. We see it all the time, but that's an issue. And for Texas to be the only state, and I didn't know any of this. I was totally ignorant about this. But then my wife got on the board of the Immunization Partnership and became chairman of it, and I got educated real fast. Texas is the only state that you have to opt into the registry of who's been vaccinated. Every other state you can opt out if you have a moral objection. We have to opt in. It's ridiculous. It's got to change. That's pure politics. And then the fourth issue that I'll just mention is this whole idea of a whole child initiative. Some of this came about from a painful experience. And there are people in this room that tried very hard for a pre-K program called Early to Rise. And the odd thing is I'm totally for the pre-K program, but the way it was being done I didn't think was right. Fortunately, it's now been rebuilt as Early Matters, and I think it's all moving the right direction, and I'll do anything I can to help. But it caused me to stop and think. I also chair the juvenile board. Why do children end up where they are? Some of it's education, but a lot of it has to do with other things. Yes, pre-K is important. Of course, that causes me, I won't get off on this tangent, but I've got to make 2 points about education. Why do we still have K through 12 and summers off? It's historic. But more important is why, when you drive across Texas, if you go into any small town and you look on the water tower, it will tell you the last time they went to the state semifinals in some sport. It will never tell you how many national merit finalists they had. You go into the cafe and they can tell you who the quarterback is, but they can't tell you who the valedictorian is. Until we change that, then we're going to continue to have problems. And I love high school sports. Nobody take that wrong. Mark White got thrown out of office for no pass, no play, largely. But we've got to change our mindset. But education, and by the way, since I'm talking about education, and that's not your issue, but you may as well be aware. There are people in Austin, in the legislature, who think public education is evil. We saw the letter that was published by an advisory group that says public education is godless socialism. How many of you went to public school? I rest my case. We've got to push back against that kind of thinking. It's absurd. And so beyond education, though, there are so many factors that go into a child's development. If you want to see real heartbreak, go to the juvenile detention center and look at a 12-year-old girl that's in there. Suddenly, I was put in charge of the juvenile board. I didn't know that was a role either. I thought it was maybe transportation, remember? That's how we started. We had this thing called the boot camp out in far northwest Harris County. The tough love approach to juvenile justice. And maybe 25 years ago, that was a good idea. It's now called the Leadership Academy, because what we found out was you'd put a kid in there, and they are kids. We don't like to remember that. You put a kid in there, and instead of feeling punished, they'd go back to the neighborhood and say, I went through boot camp. I'm tough. So instead, we took away the military uniform type. We took away the military drills, and we started talking about leadership. And the best program we've created is we have partnered with an animal shelter that takes in stray dogs. And some of these kids, 6, 7, 8 of them at any one time, who have, sort of met all the metrics and performed well, are given a dog to take care of. It's the first time they've been given anything to be responsible for in their life. And another heartbreak is, I have trouble keeping a straight face on this one, is when it comes time for those dogs to be adopted, then you see these kids giving up these dogs, and you realize you've reached them. So what else is there in a child's life that we need to be looking at? Because I grew up in that era of Ward and June Cleaver, mom's home baking cookies, kids come home from school. That's not the world we live in today. So we need to look at every aspect. Yeah, education is probably the most important, but healthcare, clearly part of it. Food, obviously part of it. Socialization, getting rid of gangs, getting rid of bullying, all those things have to be part of it. So that's why, even though the county doesn't have specific roles, we're now looking at the whole child initiative. So let me conclude by saying that we all know that healthcare has been politicized. 20 years ago, or longer than that, when I was in the legislature, healthcare wasn't a political issue at all. It was something that, if Red Duke came to Austin and told us to do something, we said, yes, sir. You say that's the right thing to do, we'll do it. Today, it's become politicized. So like it or not, this group, each of you as individuals, each of you with your extended family and your friends, have got to engage. And you've got to engage on the issues that are important to you. Don't vote for somebody, don't support somebody because they're this party or that party. Don't vote or support somebody because, they're going to lower your taxes. You don't want to get me off on that subject. But look at the issues that are really important to you and make sure that we restore sanity to public life when it comes to healthcare. That's all it is. Logic and sanity. So thank you again for the award, and thank you for what you do.
Thank you, Joe Emmett. This past year, it is my honor and pleasure to be a part of Doctors for Change, who has done incredible work with our UT students, our Baylor student chapters, as well as all our committees. Now, for some of you who have started to demo onto your smartphones, make yourself an app. Really, use it in your practice. As proud as we are of our accomplishments, we, in the words of poet Robert Frost, have many miles to go before we sleep. Many, many miles to go before we sleep. Only with your continued support can Doctors for Change make an impact on our communities, for Houstonians, for Texans in general. And one of the ways that you can, if you look on your tables, is you'll find a card. And if you can continue to provide your support, and here's an envelope. For those who'd like to put a check into the envelope, we'd more than welcome it. Otherwise, there is a little space for your credit card. And as you exit through the doors, there will be 2 baskets held by our volunteers. Please feel free to drop the envelopes and the cards into the baskets. And on behalf of our board members, our leadership committees, awardees, and staff, we thank you for joining us today. And please continue to join us in our forums, in our talks, and also at our gatherings. Thank you.
And now I'm going to turn the tables a little bit and say thank you to Daisy for organizing this whole event, which I think was truly amazing and interesting, and I learned a lot. And also to everyone on the organizing committee who served. And we also want to thank the in-kind donors who made this happen, including Central Market, Roger Tam Photography, Children at Risk, and Eric Galicia. Thank you so much. And please stay if you have time. Please keep the conversation going, get to know one another, break down the silos. And thank you again for being here. Bye.
Yeah,